Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss about gastroesophageal reflux disease, which is a chronic and more severe form of acid reflux. Hello doctor, welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, what is Gerd?
Gastroesophageal reflux disease, that is GERD, is a chronic and more severe form of acid reflux, which causes a risk factor including overeating and pregnancy. Most people can manage their symptoms with lifestyle changes or medication. Acid reflux happens when contents from your stomach move back into your esophagus. This action is called as acid regurgitation or gastroesophageal reflux. If you have symptoms of acid reflux more than twice a week, you might have a condition known as gastroesophageal reflux disease.
What are the symptoms of Gerd?
The main symptom of GERD is acid reflux. Acid reflux can cause an uncomfortable burning feeling in your chest, which can move up into your neck and throat. This feeling is often known as heartburn. If you have acid reflux, you might develop a sour or a bitter taste at the back of your mouth. It might also cause the regurgitation of food or liquid from your stomach into your mouth. Some other symptoms of GERD includes nausea, chest pain, pain when swallowing, difficulty swallowing, chronic cough, a hoarse voice, and a bad breath.
What are the causes of Gerd?
There are no single causes of GERD. There is a mechanism in your body that, when not functioning properly, can increase the likelihood of it. The lower esophageal sphincter is a circular band of muscle at the end of your esophagus. When it's working correctly, it relaxes and opens when you swallow. Then it tightens and closes again afterwards. Acid reflux happens when your LES doesn't tighten or close properly. This allows digestive juice and other content from your stomach to rise up into your esophagus. Other possible causes includes hiatal hernia. This is when a part of the stomach moves above the diaphragm towards the chest area. If the diaphragm is compromised, it can increase the likelihood that your LES can't do its job correctly. Frequently eating large meals, this can cause the distension of upper part of the stomach. This distension sometimes means there isn't enough pressure on the LES and it doesn't close properly. Lying down too soon after a large meal. This can also create less pressure than the LES needs to function properly.
What are the risk factors for Gerd?
While again, there is no one cause of GERD, there are lifestyle choices and certain health factors that can make a diagnosis more likely. These includes living with obesity, being pregnant, living with a connective tissue disorder, smoking, frequently eating large meals, consistently lying down on or going to sleep after eating, eating a lot of certain types of food like deep fried or tomato products, drinking certain types of beverages like soda, coffee, or alcohol, using an abundance of non-steroidal anti-inflammatory drugs like aspirins or ibuprofen, alcohol, and GERD. Some people who have been diagnosed with GERD find that food and beverages can trigger their symptoms. While trigger can be very personal, there are a few foods that are routinely cited as more triggering than other. They include high fat food, that is fried foods and fast foods, citrus fruits and juices, tomato or tomato sauce, onions, mint, coffee, soda.
What are the treatments for GERD?
To manage and relieve symptoms of GERD, your doctor might encourage you to make certain lifestyle changes like maintaining a moderate weight if applicable, quitting smoking if you smoke, avoiding big heavy meals in evening, waiting a few hours after eating to lie down, elevating your body during sleep by raising the head of your bed 8 to 6 inches. Medication. Your doctor might also suggest over the counter medications like those listed below. All of these medications can cause side effects. So, talk with your doctor about which option is the best for you. Antacids. Antacids like Tums are typically used for an occasional and mild symptoms of acid reflux and GERD. But if you find that you are taking antacids almost every day, you may need a stronger medication. H2 receptor blocker. H2 blocker like Pepsid, AC work to the lower the amount of acid your stomach makes. Many H2 blockers are available. OTC, while higher doses of these medicines can also be prescribed. It's important to note that one type of a H2 blocker, that is ranitidine, is also known as Zantac, was recently recalled by the FDA trusted sources for containing the ingredient N-nitrosolidimethylene, that is NDMA, which is known as carcinogen. Proton pump inhibitors, PPIs, like pre- proton pump inhibitors, PPIs, like Prilosec, also lowers the amount of acid your stomach makes because they tend to work better than H2 blockers. They are more helpful when it comes to healing the esophageal lining, which can become damaged when someone is dealing with GERD for a while. Like H2 blockers, you can buy some proton pump inhibitors OTC, and your doctor can also prescribe you a higher dose.
How is GERD diagnosed?
If your doctor suspects you might have GERD, they will conduct a physical examination and ask about any symptoms you have been experiencing. Your doctor may then recommend you to a gastroenterologist and may conduct certain tests themselves, including ambulatory 24 hours pH probe. A small tube is sent through the nose into the esophagus. A pH sense at the tip of the tube measures how much acid exposure the esophagus is getting and sends the data to a portable computer. An individual wearing this tube for about 24 hours. This method is generally considered the gold standard for the diagnosis of GERD. Esophagram. After drinking a barium solution, X-ray imaging is used to examine your upper digestive tract. Upper endoscopy. A flexible tube with a tiny camera is threaded in your esophagus to examine it and collect a sample of tissue if needed. Esophageal manometry. A flexible tube is passed through the nose into the esophagus to measure the strength of your esophageal muscles. Esophageal pH monitoring. A monitor is inserted in your esophagus to learn how acid is regulated in your body over a period of a few days. After arriving at a diagnosis, your doctor will decide what interventions will work best for you and if a surgery is an option.
What is the difference between heartburn and GERD?
There is a very real distinction between occasional heartburns, which may not need medical interventions, and GERD. Most people experience heartburns from time to time, and in general, occasional heartburns isn't a cause for concern. But if you have been experiencing heartburn more than twice a week, and especially if you have also been experiencing a chronic cough and chest pain, you might be dealing with GERD.
So, doctor, what message would you like to give to our listeners?
If you experience occasional heartburns every so often, you are not alone. Treating this occasional occurrence with OTC antacids and some lifestyle changes like waiting a few hours to lie down after eating can casually create relief. But if you find yourself experiencing heartburns more than twice a week, a small lifestyle change doesn't seem to be fixing anything. You may be dealing with GERD. If you have been diagnosed with GERD, your doctor will help you come up with a treatment plan that works for you. OTC medication, prescription, meds, and even surgery are all options depending on where you are with the condition. Don't let persistent heat burn get in the way of your life. Talk with your doctor if you believe you may have symptoms of GERD. Don't let persistent heat burn get in the way of living your life. Talk with your doctor if you believe you may have symptoms of gastroesophageal reflux disease.
Thank you, doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that this informative talk has been of great value to our listeners. Thank you, doctor, for being a part of Medica Talks.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views, and opinions from around the world.